Welcome all my viewers on Beyond Sugar once again today. It's always a pleasure connecting with you for these live sessions. As you are aware, Beyond Sugar is created for all of you in scientific collaboration with RSSDI, which is the apex body of diabetologists in India, and Indian Society of Nephrology. Not only we share information with you on a daily basis so that you are more aware about diabetes and how to manage various aspects of diabetes, but we also invite for you leading doctors from across the country who can talk to you directly as a friend and answer the queries which you have. I'm very glad to welcome today Dr. Ravi Shankar Edukulapati from the city of Hyderabad. Sir, welcome to the program.
It's a pleasure being here.
We get a lot of questions and chats from our viewers on various topics, and one such very important topics is around insulin therapy. And there are a lot of myths. There are a lot of questions which comes around insulin, and there are a large number of patients who are taking insulin during diabetes. So today we will be using expertise of Dr. Ravi Shankar talking about this. But let me formally introduce him to all of you. With almost 18 years of experience with him, he is one of the leading endocrinologists in our country. He is also trained as a type 1 certified educator as well. And not only he is doing numerous talks for his fellow physicians, educating them about the latest in the field of diabetes, but he's also doing multiple patient-centric programs, patient education through social media, television, and radio. And it's a very a good moment that he's here today with us. He's currently working at Apollo Hospitals, Jubilee Hills, Hyderabad as a senior endocrinologist. Let me, sir, straight away hand it over to you for your opening comments on these topics around myths and facts about insulin therapy, and then we will take in the questions of the audience.
Yeah, it's an interesting topic. It's a very practical topic, and it is something that most of the patients who are diabetic feel very close about it and passionate about it. And of course, the carers too, for obvious reason. And if you ask me, some of the most common questions that are posed to us, amongst the questions that are posed to us on a daily basis, I think questions about insulin definitely do surface as one of the top few. So I think you picked up the right topic. I think we'll keep going so that our reviewers would understand as to what exactly we're going to discuss about.
Sure. Let's begin from the start, sir. There are a lot of people who are having diabetes. Many of them they are well controlled on tablets, and then to some of them the doctors will advise on insulin as well. Now, to begin with, can you help us understand that which are these patients whom you recommend insulin injection, and what's the profile of those patients and why it is necessary for them to have it?
Yeah, some very basics about insulin. Insulin is a hormone. It's a chemical that is secreted from the pancreas. To be even more specific, from the beta cells of the pancreas. What insulin does, it allows the glucose which is present in the blood to go into the cells in our body so that the cells can utilize it. When insulin is deficient or when the insulin is not being utilized properly, or if there is some resistance to insulin, then obviously your blood sugar levels go up. And we call this condition as diabetes. In type 1 diabetes, there is no insulin in the body, hence the reason why you need insulin in all scenarios if a person has type 1 diabetes. On the contrary, type 2 diabetes is a scenario wherein there is insulin resistance or relative deficiency of insulin. So, in type 2 diabetes, unlike your type 1 diabetes, most people can get away without insulin, at least in the early stages of diabetes. But when they come to a certain stage, there is definite deficiency of insulin, even in type 2 diabetes. And at such a scenario, they don't have a choice but to start insulin. Also, there are some specific scenarios, even in type 2 diabetes, wherein they have to use insulin. For instance, if somebody were to be planning pregnancy and if they can't really use tablets for those reasons, they got to go on to insulin. If somebody is already pregnant again and they're not known to have diabetes, if they develop diabetes during their pregnancy, we call it gestational diabetes, and they're supposed to start insulin usually. And even if it were to be type 2 diabetes, if the blood sugars were to be in 300s and 400s, and if their HbA1c is terribly high, and if they present to the doctor, then the clinician might advise insulin instead of tablets in such a scenario. And if somebody were to be admitted in a hospital for any particular problem which warrants admission to the hospital, for instance, a planned surgery, for instance, a myocardial infarction, i.e. heart attack, or a diarrhea and vomiting bout, usually the tablets are stopped and insulin is started in such an acute scenario, and later on that insulin is weaned off. Or if somebody were to have a wound or an ulcer on the foot, then you might need insulin in order to control the blood sugars. And as if this is not enough, if somebody were to go into a coma, such as your HONK, otherwise called HHS, which is seen in type 2 diabetics, you will need insulin. So these are some of the scenarios wherein you will need insulin in type 2 diabetes. So in type 1 diabetes, insulin is the only treatment, and there is no other treatment as on today, which is the 10th of July 2024. Who knows, time might change in the future. Still, some people with type 1 diabetes have the luxury or privilege of having insulin pumps, and this insulin pump is again a modality or channel or portal by which we deliver insulin, but it's not replacement for insulin. I need to really clear this out. And in type 2 diabetics, as I earlier mentioned, yes, insulin pumps are rarely used, but usually in type 1 diabetes, we use insulin pumps. And coming to transplantation of pancreas or islet cell transplantation, which is again a common question posed to us. Yes, it can be used in rare selected scenarios of type 1 diabetes because we don't have those many pancreases and we don't have those many islets. Again, another common question which is posed is about as to whether stem cell therapy is useful. Yes, there is some research going on, but not at a level wherein we can use that in lieu of insulin at this current juncture. So this is some, I would say bird's eye view about
Yeah.
indications of insulin in a diabetic, be it type 1 or type 2 diabetic.
Yeah. So I think what we understand from Dr. Ravi Shankar today is that insulin is an important part of the whole overall diabetes management, and there are various situations when your doctor will advise you for insulin. Of course, hospitalization, some major surgeries, or if it happens during pregnancy, that's a clear-cut case for insulins. Or if it is type 1 children, they are having diabetes, then of course they need insulin. And in type 2 diabetes, which is generally in adults, so your doctor will, decide that when you need insulin and when tablets are not working. So essentially, it's a medical decision which your doctor will inform you in consultation with you. But it's an important part of the diabetes management. Sir, you although mentioned
Mr.
that,
Sanjeev, as
yeah,
you very well know, even in type 2 diabetes, if a person were to have liver failure or kidney failure, and where medications may not be working properly or not safe, again, just like in pregnancy, you don't have a choice but to use insulin.
yeah. So, your doctor will inform you and guide you in the right way. There are multiple situations. So, sir, next question, which I want to ask you, which, many of our viewers ask, they feel that taking insulin is a very cumbersome, work. It's very, very painful. And the basic, idea of taking an injection with our people is, from the childhood, you are put some fear in the mind that I'll take you to a doctor and give you an injection. So, what's the scenario? Is insulin very painful? Insulin injection? Would you like to help us, our viewers, understand this?
Yeah. I mean, even before we started this conversation officially, we were having this talk prior to this, and you and I were discussing as to how we were trained as doctors and counselors by trying to behave like a diabetic whilst we were going through training. So I think that tells a lot because if one were to really face a situation wherein he or she has to use insulin and understands that it's not all that difficult and all that painful, then I think that eases the fear. I think if you really overcome that fear factor, I think we have a wonderful medication which is doing wonders for us in terms of our bodily health. But unfortunately, as you rightly mentioned, most of the time, we get a scenario where we've been wrongly misguided by sometimes even parents as a child, where we're told, look guys, unfortunately, I'm going to take you to the doctor if you make a big fuss at home. And then starts the fear about injections, and this would continue till somebody leaves this planet and goes to heaven. So I think this should change right from day one, wherein parents start inculcating fear in the minds of children, saying, look, injection means pain. So I think if that changes for good, I think to a certain extent, there would be better acceptance of insulin. And one needs to really try to understand that it is not all that painful. And as you and I know, it's definitely not painful. I mean, it's like a sting, right? It's like an ant biting, perhaps. And these days we have such finer needles which can really deliver insulin without any pain. And if somebody is that fearful, you do have insulin pumps as well, wherein it doesn't pain, and the pump and the set lasts for good 3 days at least. And as if this is not enough, I think we need to make our patients understand that if they change the needle on a daily basis after each prick, then the pain would be almost minimal, because our people use the same needle most of the times for days together, and no wonder it is painful. So I think if you really make them understand that A, the injection is not all that painful, that things have changed, that there are finer needles, make them try in front of us, make them speak with people who are already on insulin, and last but not the least, train them as to how they need to change the insulin after each use. I think that makes the job much easier.
Yeah. No, thanks for highlighting this. And I think the simple message for our viewers is that it's not painful. And if you still have any doubt in your mind, if whenever your doctor recommends you to take an insulin, please ask him to, or his educator, in the hospital, to show you that needle, or how this is pricked. So you will lose that fear of your mind. It's no more painful at all. So, but then there is, genuine fear, which many doctors also feel, and many patients also feel, that if you take insulin, and then if the dose goes higher or more, or if you don't take food, there can be a fear of hypoglycemia, and someone can get unconscious, or if elderly people are there, they can fall. It can affect them. So, any views you have on this, or how do you guide your patients in such situation?
Yeah. Hypoglycemia, in layman's terms, is low blood glucose. The very purpose of using insulin, or for that matter, any medication that can lower glucose, is to lower glucose. So it is essentially doing the job that it ought to do. So let us not blame insulin for that, but it's either lack of training about prevention and treatment of hypoglycemia, i.e., low blood glucose, or complete unawareness about the low blood glucose and the ways to prevent it, that leads to such a case wherein the person has a low blood glucose. So I think it's essential to make sure that our patients, or our people who are using insulin, understand that insulin can cause low blood glucose just like any other medication which can control blood glucose. So this is the first and foremost thing. Insulin is meant to lower blood glucose, and if at all a person does not take food on time, or takes less food than usual, or does more work, or takes more insulin than required, or takes other medications in higher doses than prescribed, then you might end up having a low blood glucose. Similarly, if a person has kidney impairment or liver problems, or does not inject properly, for instance, if they inject higher dose by mistake, or if they use the wrong kind of syringe and draw insulin, for example, the U100 and U300, U40 story. Some people use U40 syringes, when they ought to be using U100 syringes, and vice versa. So in such a scenario, if you use it the wrong way, obviously you will have a low blood glucose. So I think it's on us to educate our patients and carers that hypoglycemia is a reality, i.e., low blood glucose is a reality, and that it can be prevented and it can be treated. So as long as there is education and awareness that is going on in an active way, I think most of the hypoglycemic episodes can be prevented. And even if it happens, if the person is aware of it, can treat it appropriately.
Okay. All right. So insulin is meant to lower the blood sugar. So, important what Dr. Ravi Shankar tells us is that we need to educate ourselves, properly get training while initiating insulin, that how do we take insulin, how do we take care of our meal planning while we are taking insulin, and very, very importantly, be aware what are the symptoms also of low blood sugar, so that even if it happens, we are able to take care of that. Thanks for clarifying this very important aspect, Dr. Ravi Shankar. Moving on, a lot of people also feel that once on insulin, it's been that's the last stage of diabetes, and now I'm on the slope. So, is it true that once on insulin, always on insulin, and it's addictive in nature, or it's the last stage of someone's life?
So you asked a lot of questions in one question. For instance, you said, "Is it the last stage?" Definitely not. they would have seen their granny or granddad being started on insulin during the last stage, because that particular granny or granddad hasn't been started on insulin when she or he needed it, and the person ended up getting a foot ulcer which didn't heal, or the person developed kidney problems and unfortunately died of it. So somebody out of the best of intentions might have started insulin when that person is terminally ill. So they relate this to the fact that insulin was started during the terminal stage, and they think, look, yeah, if I were to start insulin now, I'm going to die. No, it's not like that. If you don't start insulin when your doctor advises you, then you might end up developing various complications and end up dying or developing the various complications because of lack of insulin in your body when it ought to be given. So that's what needs to be conveyed to our patients. That's one. The second thing is it addictive? Come on, yeah, it's not a drug, as in an illicit drug to be addictive. It is a life-saving medication that is being prescribed to you by your doctor. It is not something which is addictive. Your body needs it, and your doctor is advising you to take it because it is necessary. So I think this message has to be conveyed. It is not at all addictive. It is a dire necessity that ought to be taken if your doctor is advising you. Then comes the third question. Is it for life? It may or may not be for life. For example, in a type 1 diabetic, if insulin is advised, it is for life. In a type 2 diabetic, if it is advised, it may or may not be for life. So you need to discuss with your doctor as to whether it is for life or not for life. In type 2 diabetes, for instance, if somebody presented for the first time or diagnosed for the first time with a blood glucose reading of say 500, obviously the doctor would start you on insulin, but it's a temporary thing in most of the cases. Similarly, if you were to have a foot ulcer, and if your HbA1c, your 3-month sugar average is well controlled usually, but your sugar readings are shooting up temporarily because of the foot infection, then your doctor would put you on insulin as a temporary thing. It's not going to be for the rest of your life. Similarly, if somebody were to conceive, become pregnant, and if you're diagnosed with diabetes, gestational diabetes as we call it, for the first time during pregnancy, your doctor is putting you on insulin. This is only for the pregnancy. It's not for the rest of your life. Again, if you're admitted in the hospital and usually you take tablets, because of the fact that the guidelines advocate insulin during admission, and because it's easy to maneuver and adjust the doses, you're put on insulin as a temporary case. It's not for the rest of your life. So I think it's important for us as care providers to educate our patients, and similarly for patients to ask if it is for life or not, and not assume that it is for the rest of the life. So I hope I try to answer all your
Yeah.
questions.
Yeah, I think you have very nicely clarified all aspects around it, and I'm sure that your answers would have built the confidence of our viewers today that they can adopt insulin. It's not addictive, it's not lifelong, and it's definitely not the terminal stage. So, feel in fact, it can save life, if timely initiated. So there are also, a lot of questions we get, and people feel that insulin is very unaffordable. It's very costly, the newer insulins which are prescribed, and it can be a big burden on a patient's pocket. So what's your view? Is it really so unaffordable and costly?
It's a good question. See, even within insulins, there are different kinds of insulins, as you very well know. I'm speaking from a cost perspective. See, it's like this. There are many cars in the market. Some of the cars are not all that expensive. They still serve the purpose. Some of the cars are more luxurious. They do have more comforts. They do have a lot of safety features. They're a bit more expensive. And there are those ultra posh cars, which are really branded. People crave for those. They're even more expensive, and they come with a lot of safety features. Similarly, there are different types of insulin in the market, and some of the insulins, the old style insulins, are less expensive. They're really cheap to the extent that 300 units come at a cost of $200, which is very cheap by any standards. And there are insulins from the same company, for example, which can perhaps be around 1,000 rupees for the same kind of dose, as in 300 units equal to roughly $1,000. And again, from the same company, you would have insulin, the same dosage, 300 units in total, might cost somewhere around 1,400 rupees. So what I'm trying to say is it all depends on what benefits you are expecting from it, the convenience factor, the safety, and last but not the least, the kind of pen that you're using as well. So I think overall, I would say that yes, there are different types of insulin, and the cost can be variable. And last but not the least, I want to emphasize, I think everything translates into health outcomes if you go for the novel insulins, which are called analogs, to a certain extent. Because at the end of the day, if you end up having one significant low blood glucose reading, and if it warrants hospital admission, that cost is going to translate into a lot more healthcare burden and cost compared with using a newer insulin or an analog insulin, which costs a bit more, and preventing that low blood glucose episode, because newer insulins are usually safer in terms of low blood glucose reading, and they're probably a lot more safer compared with your older insulins. So this is one way of looking at it if you really look at health economics. So I think I think we have an array of choices there. It all depends on what we want, and your healthcare provider again can discuss with you and make you understand as to which one is better for you and which are all the options that are available.
No, I think again for our viewers, it's a very important piece of information which he has shared. Uh, it all depends on what kind of health outcomes you are looking at, and there are different types of insulins which are priced differently, and maybe the newer ones may be little costlier than the earlier ones, and also offer more benefits to you. But I think one thing I like to add here, with permission of Dr. Ravi Shankar, is that insulin, whenever your doctor has prescribed, is important life-saving drug for you. In case you feel that this is unaffordable and very costly to you, don't stop it, please. Have a word with your doctor and openly discuss with him. He may be able to give you another option of insulin, which may be a little more affordable to you, which is at least
Let me add a bit
not
more,
something.
with your permission, Mr. Sanjeev. We do have the benefit and luxury of actually having some NGOs and governmental organizations supporting people who can't afford insulin. Okay, so we need to really consider that as well, because there are scenarios wherein they have really come to the aid of such patients who are who are not able to afford insulin.
Yeah. So a very, very important aspect again shared by him. Sir, as we're running out of time, I'll take another important question for which I get a lot of queries, and that's like, what kind of impact it has on the social life of an individual. People feel that, if your doctor has prescribed insulin, then you can't be traveling outside, for a few days. If you have to go to a party or a function, how will you take insulin? So there are a lot of, stigmas or psychosocial issues related to it. What's your view, and how do you guide your patients on this?
See, one should not see insulin as a stigma. It's a life-saving medication. If you need it, you need it. And a lot of celebrities do have, diabetes, and they are on insulin. Wasim Akram from our neighboring country. There are a lot of celebrities within our country. Kamal Hassan, to name a few. They are actually proud enough to open up, saying that, look, we are on insulin or we have diabetes. Sonam Kapoor, one of the Bollywood actresses, and these people, what they're trying to convey is, look, taking insulin doesn't mean that your life stops there. Okay, we need to forget the fact that gone are the days when insulin is considered a stigma. There are many people who are opening up, saying, look, I'm on insulin and I'm leading a healthy lifestyle and a happy lifestyle, and it's very flexible. The newer devices, especially the newer pens, are so easy to use. You can inject even immediately after taking food. Gone are the days when you're supposed to inject your insulin 30 minutes before food. Now you can inject insulin even immediately after food. That's one big advantage. And you can carry very conveniently, because it comes as a small pen. Don't have to draw using a syringe. That kind of cumbersomeness is gone now. It's no longer the case. So you need to remember that technology has allowed us to carry this in the form of a small pouch, and we do have ice packs as well, which can enable us carry these safely even when you travel. And if you don't want any of this, and if you're happy to afford an insulin pump, then of course insulin pump is all out there, which is barely visible, and we do have such pumps which almost behave like your pancreas, which do the job that your pancreas does almost there. Okay, so I think we do have we do have a lot of options these days, and gone are the days when you're supposed to inject half an hour before food, use those old style syringes, draw them in front of everyone, feel a bit embarrassed, so on and so forth. So I think carrying them is not that difficult, using them is not that difficult, and even storing them is not that difficult. as long as you discuss that with your healthcare provider and as long as you follow that advice. So we are out there to, for example, why are we doing this program? We're doing this program to enable people understand that using insulin is no longer a stigma or a taboo, and it can be conveniently used. And there are many celebrities who, I mean, sports persons, right, who are using it. So obviously, if it is that difficult, they won't be able to perform as well as they are performing. So we need to remember these facts.
Yeah, I think these should be very, very confidence building for the viewers. So I'll take the last question from you, and this is about, you mentioned in the beginning of this program about the type 1 patients who are children, and they have to then, most of them have necessarily, they have to be taking insulin. But then a lot of parents get worried that how children can take insulin and when they have to go to school, how the routines will be managed, and it's a big, worry on their mind. And since I saw that you have done a lot of work around type 1 diabetes and educating those patients, can you help us understand how do you guide such patients or the parents of these patients?
See, at the end of the day, we assume that children really wouldn't be able to cope. But trust me, it's children who really cope a lot more better than adults when it comes to insulin usage, and they learn so fast. I mean, you must have seen kids how they play with apps and technology a lot more easily compared with adults. Okay, so I think they learn just like this. I mean, for them, initially they might actually throw some tantrums, but later on, once they get used to it, they are the ones who would use it a lot more conveniently compared with adults even. And of course, the teachers, the close friends, and of course, parents need to be educated. For example, if a kid is going to school, then the teacher needs to be told about the fact that the kid is on insulin, where it ought to be stored, when it needs to be taken, what needs to be done if the kid has low blood glucose reading. And even close friends, I would say, need to be told about this, because if close friend knows how to identify when his close friend is in danger and who's on insulin, then obviously there is some backup. And last but not the least, parents needs to be reassured that kids really cope very well as long as the parent is not too anxious about this. So I think there are a lot of support groups as well these days which are coming up, and these support groups can help cope with these kind of fears and anxiety.
Yeah, I think I must thank you here for addressing the questions of this special group of patients and their parents as well. Well, as I see the clock, we are on our time as well, and I must thank you here for I think touching on all the aspects of this important subject about taking insulin and busting the various myths around that. Not only giving us the facts, but also sharing with us that what are the solutions for the patients which they can adopt. Well, but before I thank all my audiences who joined us live for this program or who would be, watching us later, let me give it back to you that if there are still anything important which we missed to touch and you still want to emphasize or anything you want to, say in the summary for this program.
Thank you, Mr. Sanjay Mehra. Essentially, this topic, as we know, is about the myths and facts about insulin therapy. I think we need to remember that insulin is a lifesaver, full stop. And if it is advised by your doctor, I think whether we like it or not, we need to adapt it and accept it. And for that, as healthcare providers, I'm sure all of us are here to educate our patients, enable them use it properly. I think this message needs to percolate properly, and if it is percolated properly, I'm sure that would be an invaluable thing for most of our patients,
Well,
and of
I
course,
think
carers
that's
too.
Yeah, and I think that's the objective also of today's program. So I must thank you here, Dr. Ravi Shankar Edkulapati, for giving us all this, wonderful clarifications, tips on how to, manage those patients who are on insulins. I must thank here all our viewers who joined us live today or who would be watching this program later on. In case you have anyone at your home, in your family circle, friend circle, who is having diabetes or who may be, needing insulin, you can simply share the link of this program for them, and this discussion can be very, very useful for them. If you live anywhere in Hyderabad, Andhra Pradesh, Telangana, and you have more queries around this, or you want to meet Dr. Ravi Shankar, he's at Apollo Hospitals, Jubilee Hills, Hyderabad. You can meet him. If you are watching us anywhere else in the country, in some other city, you can simply visit your nearest endocrinologist or diabetologist and gain more knowledge. Thank you so very much, everyone. And Dr. Ravi Shankar, thank you so very much for joining us today and answering all the questions.
It's a pleasure.